But when I discovered the work of Dr. Thomas Seyfried, I was amazed. I was astounded. And I felt that this is a part of getting the message out. He's like the John the Baptist when it comes to cancer, sharing which way that we need to look at. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Thomas Seyfried is here to do just that. Welcome back, Dr. Seyfried, to the classroom. And I know that you have said before to call you Tom or Dr. Seyfried. I don't know which one you prefer, and but what would you like for me to address you from this point on?
Yeah, well, you can, Professor Seyfried is what I generally go by.
Professor
Because
Seyfried.
some people assume that by calling me a doctor, you think I'm maybe an MD, and I'm not an MD.
No, you're PhD. And what the discussion here is not to give medical advice, but to make us curious instead of critical for a new truth, something different that could make a difference in possibly our life or the life of others. So you're probably classically trained, because I know that you've got your PhD in genetics and biochemistry. So I am sure that you learned what we all know about cancer. At what point did your perspective change, or did you always believe in the method that you learned from Warburg, the effect? So let's talk about how this shift happened with you.
Well, I think, thank you, Lillian. Listen, I think that most people in the field learn that cancer is a genetic disease. I guess if you're not doing research in the field and you are teaching students, you just look at the textbooks and follow what the textbooks are pretty much saying, that this is a genetic disease. For most of my, not most, but half of my career, I never really gave much thought of it to what it was. Other than what everybody else said it was. It was a genetic disease. It only became clear to me, and I really didn't know about Warburg. I mean, you only hear the name Otto Warburg. People hear it for various reasons, and metabolism and things like this. But you really, I didn't realize until when I was doing epilepsy for years and years with the developing therapies, metabolic therapies for epilepsy, and also doing just brute force biochemistry on tumors. It wasn't really to cure anything or manage anything. It was just to figure out, like everybody, like so many others, just, what changes do you find inside tumors? And we have two simultaneous research projects going on, first at Yale University and then at Boston College. And, there was an overlap of knowing that calorie restriction, ketogenic diets could block epileptic seizures through a reduction of glucose. And, one thing leads to another, and all of a sudden you're studying these same procedures on some of the tumor models that you've developed, that we developed over the years. And the next thing you know, we find that some of these therapies that we were using to manage epileptic seizures are even more powerful for managing cancer. And Warburg always said that, cancer is a disease of mitochondria, energy metabolism. And when the cell can't get energy from oxygen, it ferments. And the main fuel for fermentation was glucose, the sugar. So we understood that if we lowered blood sugar in children with epilepsy, seizures would invariably, for most times, be managed quite effectively. But we had no idea that the same strategy would be powerful in restricting the growth of a tumor. And the idea that Warburg had already plowed the fields for understanding what was going on, whereas in the epilepsy area, we still are pretty unclear how restricting of calories and glucose can manage an epileptic seizure, an explosion of electrical excitability in the brain. But for cancer, it's strikingly clear what's going on in that disorder. So we began to then do a deep dive into what Warburg had said based on our findings in our own research. And then I began to see the controversies and the confusion associated with what Warburg had found. And over the last 25 years, we have now clarified in no uncertain terms that Otto Warburg was in fact correct in his identification of cancer as a disorder of energy metabolism. And now we have patched up many of the controversies and solidified some of the misunderstanding with new data. So this is where we are. We know we have a clear understanding of what cancer is, a clear understanding of how to prevent it, and a clear understanding of how to manage it.
Okay.
So, but the problem, as I said, is that the field has become solidified around the view that cancer is a genetic disease, which is a theory that is responsible and underlies the entire industry that is in the process of managing and treating cancer today, which now we realize is incorrect. Not to say that people can't benefit from standards of care that we use, but many of those benefits come at a significant price
Correct.
to the health and viability and vitality of the individual that's treated. So in our view, cancer can be managed without toxicity. If one knows. And the other thing is the patient themselves must now play a much greater role in the management together with diet drug combos that can allow us to manage better and provide longer quality of life and overall survival. It's just a matter of time. It just takes time for the folks to understand what's going on and the system to make changes that will be necessary to move in the right direction.
If you want to learn how to implement the ketogenic diet and the Press Pulse protocol into your cancer management, just visit school.com/keto for cancer, the new community by our research analyst Johnny Rockermeyer. Within this new community platform, you can connect with other patients and learn from their experiences. You can also just search through the posts other members have already made. You will have access to our classroom section as well, which provides practical advice and tools for the best results. These sections cover all parts of the Press Pulse protocol that you should implement. Starting with the general scientific concepts by Dr. Thomas Seyfried, we will show you how to start the ketogenic diet, including which foods to choose and which to avoid. Additionally, we prepared a list of doctors specialized in metabolic therapy, as well as details about glutamine inhibition and hyperbaric oxygen protocols. So, take a look around at school.com/keto for cancer.
Yeah, and you know what I love mostly about you is your patience. You want the message out there, and your patience and perseverance is admirable. So I am just in awe of the fact that you're able to continue to stay focused on the message and not what's not being heard or what else is being said. And so thank you for that. Thank you for staying focused. That's why I said you're like my John the Baptist here, because there was a focus there. So with that in mind, you said we know what cancer is and what it is not. So let's talk about what is cancer and how to prevent it. So let's go from what is cancer, how to prevent it, and how to reverse it. So let's go from there.
Well, let's not say how to reverse it. Let's just say how to manage it.
Okay.
It's better to say we have a strategy for cancer management.
Okay. I love that.
Whether that management leads to resolution or not,
Okay.
it will take time for us to understand that. But the definition of cancer is a very simple one. It's cell division out of control, dysregulated cell growth. That's it. That's what cancer is, dysregulated cell growth. So the question, of course, is if you have dysregulated cell growth in a particular organ, a breast, a colon, a bladder, a brain, a lung, wherever, you have a population of cells in that particular organ that for whatever reason, and we have defined all the different reasons, that these cells start to grow in a dysregulated way, different from what we call our society of cells, which are differentiated, quiescent, only only a natural turnover and proliferation that's a very regulated proliferation needed only to replace those cells that would die by natural causes. When I say that by programmed cell death, it's an internal program for cells to die when their functionality becomes naturally compromised. But a cancer cell doesn't die naturally. What happens is it gradually accumulated abnormalities in its ability to use energy and falls. So normally when that organelle, the mitochondria, become damaged for any number of reasons, the cell will up and die. And that's the end of it. And no cancer can come from a dead cell. That's what Warburg said. I mean, so the damage to the energy production in the cell has to be chronic. And this is the thing. Cancer just doesn't explode from nowhere. You don't go to bed at night and wake up with a big tumor on some part of your body the next morning. It's a chronic interruption of energy metabolism, which could be over decades, causing a constant irritation or disruption of the microenvironment or something like that. And the cell, rather than dying, slowly adapts to this inefficiency of energy, and then starts to get energy without oxygen. This is the key of all cancer cells. They don't use oxygen, and they don't need. Let's put it this way: they can grow without using oxygen. If you put them in hypoxia with no oxygen, or areas where there's very little oxygen, cancer cells can grow. This is one of their signature features. They also don't die when you expose them to cyanide. And we know that cyanide is a very toxic drug. The drink the Kool-Aid concept all came from the cyanide drinking in Jonestown, and kills people almost instantly. But cancer cells can live in cyanide in the environment because they don't use oxygen. So if they're not using oxygen, Warburg said, what do they use? And they ferment. And all of the cells in our bodies have the capacity to ferment for short periods of time. We can hold our breath and turn purple, and that's because we're not breathing and we're fermenting. But if you do that for too long, you're going to die. And heart attacks, we stop breathing, and we have a tremendous shift to a quick fermentation metabolism. But it can only last for a short period of time. It can't last for long periods of time. And it's interesting, during heart attacks and holding long breath or this, you find two metabolites that accumulate in the bloodstream, and that's the lactic acid, called lactic acid, and succinic acid. And these are acid molecules that are indicative of a fermentation metabolism. And the lactic acid comes from glucose. So the sugar glucose is metabolized. Normally, glucose would be fully oxidized in the mitochondria, but if the mitochondria become unable to get energy from oxygen, then there must be alternative forms of energy, because without energy, everything is dead. So what happens in an acute interruption of oxygen, the cells must stay alive, and they immediately explode with this fermentation metabolism, which is energy without oxygen. And you start to see the waste products of this metabolism in the bloodstream immediately. You start to see lactic acid and succinic acid accumulate. So Warburg had always said that the lactic acid was coming from a massive increase in glucose consumption to make energy, to replace the energy lost from respiration, oxygen. We and others have now shown that succinic acid is also there, and that comes from the amino acid glutamine. So the interesting thing is that cancer cells are always producing lactic acid and succinic acid, even in the presence of oxygen. So what that says, and told Warburg and us, that clearly the mitochondria, the organelle that controls energy metabolism in the cell, is corrupted and dysfunctional and inefficient. So the cancer cell has simply adapted to using fermentation, and that's why it grows without oxygen. It can grow in the presence of cyanide. It can do all these things because it's fermenting. It's using energy without oxygen. And this energy without oxygen is the how cells evolved on the planet, 2.5 billion years ago, when there was no oxygen in the atmosphere, yet there were living cells. And as gradually life on Earth evolved in a hypoxic environment. So we have the remnants, the heirlooms of those pathways still present in most of our cells today. The problem is they're very minor, they're very minimal. And but when you stop breathing and you have heart attacks and things like this, those pathways become very robust. But they can only provide energy for a short period of time before you eventually die. But the tumor cell has completely adapted because the gradual destruction of the mitochondria didn't happen acutely, it happened chronically. So these cells simply fall back on this ancient pathway of energy. And you have to realize that all the cells that lived on the planet at that time had dysregulated cell growth without regulation, just like a cancer cell. And they would live and grow as long as they had those fermentable fuels in the environment that they existed in. So cancer cells will grow as long as they have the fermentation fuels in the environment. And those two fuels are this glucose, the sugar, and the glutamine amino acid. So it becomes very clear what's going on with cancer. It's a disorder of energy metabolism driven by ancient fermentation pathways. And as long as those cells have the pathway, the fuels in the environment, they're going to be very hard to kill.
Can oxygen, you had mentioned about oxygen and how oxygen doesn't, may not, maybe understood incorrectly, but can oxygen, because if cancer cell can live without oxygen, can oxygen damage that cancer cell? Have you done any research on that?
Yes, but you have to reduce the fermentation.
Okay, so that means change the way the person is eating, or
yeah.
Okay, so
you put the body in nutritional ketosis.
Okay.
You lower the blood sugar and you elevate the ketone body. The ketones are a remarkable fuel, as my late good friend George Cahill and Richard Veitch, they called it the super fuel because it can protect the mitochondria. It makes them super energy in the normal cells of our body. In the normal cells of our body, it can actually reduce damage from oxidative stress. But the tumor cell is vulnerable to oxidative stress only if you lower the fermentation fuels. So if you lower the fermentation fuels, the tumor cell becomes remarkably susceptible to oxidative stress. And this is one of the reasons why my colleague Dominic D'Agostino from University of South Florida developed the hyperbaric oxygen for cancer patients, because what happens, but you have to have the patient in nutritional ketosis. The ketosis will protect all normal cells in the body, but not the tumor cell. The tumor cell cannot use ketones or fatty acids for energy. So they become vulnerable to oxidative stress when their fermentation fuels are depleted. So that's our plan. Your plan is you lower the fermentable fuels to the cancer cell, and then you can kill them by a large number of different non-toxic strategies, hyperbaric oxygen being one of them.
Okay, what are some other strategies that you can use?
Well, I think that the most important strategy is lowering the blood sugar and elevating ketones. And then because glutamine is the most abundant amino acid in our body, there's no diet or way you can reduce glutamine, the other fuel, the other fuel. So we use small doses of drugs that target glutamine, and glutamine can be reduced with exercise. So if people were fasting and exercising, the body reduces glutamine levels, and then you can use small doses of glutamine targeting drugs that would be non-toxic, as long as the patient or subject, I want to call it a subject, would be reduced in glucose and elevated in ketones, and then small doses of glutamine targeting drugs would be used in our concept of the press pulse therapeutic strategy that we published. Then there's a real chance that you could slowly degrade this tumor, any tumor for that matter, by strategically applying this prolonged attack on the tumor while enhancing the health and vitality of the rest of the body. So it works. It works really well for folks that are into it, know what to do and how to do it. So but the problem is it's this strategy that I just described. And of course, the description is in great detail written in our papers, the minutia of what I'm talking about.
Yeah.
It's just not done today, and but it can be done. And I think it's just a matter of time before this becomes the standard of care. But how long that's going to be is not clear to me.
And that's why it's so important for you to stay focused, and because you never know who's going to run into this podcast that might just be diagnosed with cancer right now. And one of the things that I say is the allopathic treatment is you need to rush, have these chemicals put into your body, and you can continue eating the way you're eating. You can continue your lifestyle the way it is, but just put these chemicals in your body. What is your advice to someone who is just now contemplating what to do for themselves because they were just being diagnosed with cancer? And by the way, I've heard of people that have a very, very small amount of cancer diagnosis where but they say, oh, you need to take drastic measure like amputation or a removal of an organ or things like that. What is your advice to
Well,
someone?
that's a complicated situation, but you've kind of encapsulated it in a way in which is currently done, and I think there's so many problems, and again, I can't offer medical advice because I'm
Correct.
a physician. I only can give you knowledge and information
Mhm.
that provides an alternative to this.
Yes.
The first thing, when people are diagnosed with cancer, there's always this kind of from most people, not all people, but there's a kind of a shock, an impending doom. My life now is finally finite. I see that I could be dead. I mean, and this creates a tremendous amount of emotional stress, not only to the patient, but also to the family. And this is not productive. Um, in metabolic therapy, you can start managing the tumor aggressively by changing the diet and lifestyle. And not to say that, it's our view that surgery can still cure cancer in a lot of folks. But the tumor has to be put into a indolent state. There's always a risk that if you attack the tumor too aggressively at the beginning, you run the risk of spreading tumor cells throughout the body and defeating the very purpose of what you're doing.
Are you referring to a biopsy? Because I've heard that biopsies may not help as much as just removing the tumor that is in question.
Yeah, well, I think, I base my information from my deep discussions with my physician colleagues and also from the numerous papers that have been published in the scientific literature describing the spread of tumor cells following either surgery or biopsy. Not that it happens often, but if it happens occasionally, the poor person that it happened to is at a disadvantage for overall survival. But I think that in metabolic therapy, the person would shrink the tumor down significantly prior to any manipulation of the tissue itself. And then, of course, you can either debulk completely or remove entirely the lesion without further ado, and that could potentially lead to a complete cure. Again, as I said, surgery can cure cancer if the surgeon is able to take out all evidence of the neoplastic lesion. And that's what you ultimately would like to do. And that could also be done by a focal shot of radiation. If the tumor is completely circumscribed and nowhere else but in that one location, then it could either be surgically debulked or irradiated to completely remove it. the problem is that some of the procedures that are used for diagnosis can run the risk of spreading the tumor around before you can, fully
Yeah.
take care of it. So
Yeah.
I think that knowledge has to be known, that there are certain things you can do up front before moving into certain other strategies, and that all has to be discussed between the physician and the patient. The problem, as I see it, is that oftentimes the oncologist or physician is not unaware of the biology of the nature of the problem. Rather than being your advocate and working with you, sometimes they don't understand any of this,
Mhm.
and it becomes difficult for the patient. The patient sometimes knows more about this than the physician, and not always, of course, but it does happen. And I think it has to be a working relationship between the knowledgeable patient and the knowledgeable physician. And together they will be able to manage more effectively the majority of types of cancers that people will have if they do the procedures in the right order in the right way, and using non-invasive technologies to determine whether a tumor is being managed or not. But we have so many MRIs, PET scans, CAT scans. You have a lot of non-invasive ways to know whether or not something is being changed in the way it looks. And you have radiologists who can clearly determine whether or not some positive or negative thing is happening to this lesion. And so that's our view. Our view is that you can do a lot upfront prior to in any kind of an invasive attack on this problem. And therefore, I think in the long run, you're going to have much better outcome with higher quality of life and longer term overall survival. Whether it leads to complete resolution or not, depending on the kind of cancer it is and how far it's already spread or developed, there might be variations to this for sure.
Yeah. And you know what? I believe when I hear you say that sometimes the patient knows more than the oncologist, the problem is that the oncologists, for the most part, and this is my opinion, not and what I've seen, and I'm not saying that this is what you believe, but there is a level of fear that the oncologist or the person who's trying to prescribe a treatment to the person that is chemically induced or whatever it is, there's a level of fear and breathing that if you don't do this, you're going to die. So there's a level of fear that encourages a level of manipulation. So I always say that when anyone has any form of a diagnosis, they need to just stop and research the good, the bad, the ugly, the what can be done, because we call this alternative medicine, but really it's natural to go to change your lifestyle. And I used to be in imaging before I started doing this. I was a marketing rep for an imaging center, and they had a PET scan. And when I would call on some of these oncologists, there were and treatment facilities, there were donuts and cookies and sodas for their patients as they waited for their treatment. And now I look back at that and I feel that that's so irresponsible, that whoever is in oncology, whoever is treating, they should be looking at research that you've written and other people that have collaborated with you and others who are saying similar things, that everybody needs to be responsible, because lack of knowledge is not an excuse when you are talking to a patient.
That's true, but you have to realize that the oncologists are trained in their profession.
Mm-hmm.
They're not trained to know that cancer is a metabolic disorder. That's not part of any oncology training in any major hospital today. And they're working under the guidelines of the National Cancer Institute, which says cancer is a genetic disease. So rarely does an oncologist come up to a patient and say, let's talk about the biology of your tumor. And I would say that over 90%, maybe more, never heard that the cancer can't grow without glucose and glutamine, the two fuels that drive the dysregulated cell growth. So there's a massive gap in knowledge, not only in the training of the field of folks that participate as caregivers in the field, but also the kind of research that's being done throughout the country and the world in targeting genes. And you hear people talk about, oh, I have this mutation or that mutation, and we're going to target this or that mutation. And this is, they have these mutations for sure. Oh, we're not saying that. But most of the cells in the tumor do not all share the same mutation. But they're all fermenting. None of them can live without
So they have that in
glucose and
common. They're all fermenting. They have that in common.
And that's the one big missing piece of information, that they all suffer from a similar problem. And not only that, it's not just a particular tissue like breast, or we found that every major cancer has the same problem. So you could have a lung tumor, a breast tumor, colon tumor, a brain tumor. They're all fermenting. And it's just a matter of targeting the same two fuels, transitioning the body over to ketones, which the tumor cells can't use, and just using that same strategy. Now, this is very, very controversial and disruptive, because what I'm saying is, yeah, all these cancer cells are very similar. They have a common problem. And this is what Warburg said. And we've absolutely confirmed that in all of our research. So, to say that we have a specific treatment for you and your specific cancer doesn't make any sense, because you could use the same thing on all the cancers if you knew that they were all a metabolic disorder. Yeah, it's a real problem. And we hear precision medicine, and we hear all these different kinds of things. And they're all based on the somatic mutation theory, thinking that cancer is a genetic disease. And yes, cancers do have mutations. But they often differ from within even a single type of tumor. Almost every different cell in that tumor has a different constellation of mutations, but they're all fermenting. So it makes more sense to target the common problem that every cell in the tumor would have, rather than some unique mutation that one or two or a few, or even 50% of the tumor cells would have. Not to say that immunotherapies, which are the new thing that people pay a lot of money for, have no value, because there are a lot of folks that have been cured by using immunotherapies. But then there's just as many that have killed by the procedure, and they don't hide that. I mean, if you listen to usually at around the 6 o'clock news, 6:30 news at night is when you get barraged by all the cancer things, because they know most of the folks that are watching this, they're not young people, they're older people. And you hear about all these adverse effects from, and they don't hide the fact that these things will kill you. No. The issue, of course, is we have never seen anybody die from metabolic therapy. Let's put it that way. And generally, you get much healthier. You don't have the side effect is that you might get rid of your type 2 diabetes. You might lose a little bit of weight. Your blood pressure will go down. Yeah. Your cognitive skills will improve. Those are like the effects of metabolic therapy.
Well, those are incredible side effects, and those and we hear these side effects of choosing a natural way. And I know that there's a need somewhere along the way to have like small doses of medications or whatever. But for the most part, we hear, your health will improve. You'll get rid of your clogged arteries or heart condition or fibromyalgia. You'll get rid of all these things if you follow this protocol, and they'll dismiss it. But then they'll hear that this could cause death. It could cause your hair to fall out. It could cause, side effects long after you've done the treatments, even though you're now considered, a survival rate. But other things happened with a family member that, after chemotherapy, they were deemed that they were surviving it. And then towards the end of their life, they could not swallow, they could not eat, they could not, and so, but that was direct correlation of the chemotherapy that was received. And so we don't talk about that. We don't want to talk about the negative aspect of choosing that route, but then we dismiss, you know, all the
Well,
good
I
side
think, yeah,
effects.
I think you're right. Well, first of all, I think many people who have cancer fear sometimes the treatment as much as they fear the disease itself.
Correct,
They
correct.
know they don't want to have organs. They don't want to be subjected to surgical mutilation, baldness, all the other bleeding gums, all the other disruption of your microbiome.
Yeah.
I mean, all these things that happen as the result of trying to kill tumor cells. And but you do so much damage to the body with these I would call medieval kind of approaches where you don't really need to do that. And the other thing that people some people they just say they reject completely standard of care and medical knowledge, and they run out to what you mentioned, alternative therapies. And listen, there's a lot of these alternative therapies that are all the misinformation
Sure.
and can harm the patient as well.
Yes.
They throw all these supplements and this stuff at patients saying, oh, you know, this could help you. And a lot of times it has no medical value at all. And then the poor patient doesn't know what to do.
No.
The best strategy in my mind would be, unfortunately, to have the oncology field recognize that this is a metabolic disease, and that with the appropriate training and knowledge of the oncologist, the patient and the oncologist would work together as a team, both being totally aware of what you need to, of what that individual person needs to do to manage their cancer. So the lack of knowledge is so profound in the oncology field that we have this, I would call it one of the greatest disasters in the history of medicine. The fact that we're treating, and it's so many thousands of people in an inappropriate way, and it's not getting better. Breast cancer has now replaced heart disease as the #1 killer of women over 40. And this comes from the data from the American Cancer Society.
Yeah.
So they tell us every year how many people are dying.
We
We have
know.
almost 1,700 people a day in the United States are dying from cancer. And these are mostly horrific tragedies.
Yeah.
And this is not an insignificant situation. This is one of the great tragedies of history here. And it's only because of the system itself is just misguided.
It's too large to fail, which is what we were told when the banking system collapsed, when the housing crisis happened. They had to rescue all the banks, but the people that were actually dealing with the problem were not rescued. So it happens all the time, and we just need to be smarter about this. And I want to shift a little bit before we go, because I do want to talk with Dr. Thomas Seyfried, a Professor Thomas Seyfried, about glioblastoma, because that is the research there is indisputable. You just have to learn about this. But before we go there, I just want to encourage you to go to whenyouneedafriend.com. While you're there, please subscribe, like and follow me on all social media. Check out my sponsors, support them the way that they're supporting the classroom. Know that we just recently changed the I Am the Solution Natural Health Summit to April 6, 2024. We had some changes beyond our control, and we are going to now create something bigger and better. And so we're really excited about that. So please tune into that. There's a code Lily001 if you want to receive $24 off. And so the next thing I want to let you know is that if you go to the Shop Now bag, you will find all my Lily approved products from head to toe. These are products that will enhance your body without chemicals or pills that you need to take. So enjoy learning about your body and how your body will respond kindly when you treat it with the love that and respect that it deserves. And then last but not least, you can become an enrolled student in the classroom. And if you want to donate $1 or $1,000 a month, and thank you to all of you that donate $1, because if all of you donated $1, we wouldn't have to be dealing with some of the limitations that we're experiencing today because of all the suppression of information information that is happening out there. And so by you sharing this video, liking and making comments, putting emojis, it helps with the algorithms. And once there's enough, the algorithms cannot touch the podcast. So I just want to make sure that all of us do our part, whether it's your time, your talent, your treasure, whether it's a one-time donation or monthly, all of it is very much appreciated. So today we're talking with Dr. Thomas Seyfried. He's a professor at Boston College, and he's teaching. I mean, I can't imagine the minds that are blown away because you are there and teaching this information. For those of you who would like to reach out to Dr. or to Professor Seyfried, you can go to thomas.seyfried@bc.edu. And if you need some of the information that he can send you some information, but he asks that you give a donation to a foundation. The foundation is called, I have it right here. I'm so sorry. Let me find this foundation before, and you can share the name if you'd like, but it's Foundation for Metabolic Cancer Therapies.com. By donating there, that helps further this mission as well, which I call a ministry, because I don't know if I told you this, Professor Seyfried, that I have a foundation called the McDermott Holistic Healing Foundation, where we share options, and our goal is to eventually help pay for treatments that are natural treatments or treatments that are different than what the allopathic community prescribes. But it's difficult because people want to give to the pink tutus and do what everybody has been told to do. And so, you know, teachers like you are imperative that we get the word out, and all of you share this information. So I want to thank you so much for, like I said before, for persevering and staying focused on sharing the message. So thank you for that.
Yeah, thank you.
Okay, so I know you've done a lot of work with glioblastoma, and I've known some people who the treatment is what killed them. And when I heard you talk about glioblastoma and what happens when you receive the treatment, it all made sense to me. So share a little bit about glioblastoma and how it's treated, and how you suggest, not as a doctor, not as a prescription, but what are some of the things that people can do if they have that diagnosis? God forbid they would have that diagnosis.
Yeah, well, of course, that's a really deadly form of cancer. You know, it's like the pancreatic cancers. It's a very low survival rate for that. You know, we know that it was responsible for the deaths of John McCain, Ted Kennedy, and President Biden's son, Beau Biden, and many, many, many others, of course. The survival is very, very low. But we published papers after I had the opportunity. I work in neurochemistry for many, many years, as I said, with epilepsy and lipid storage diseases and this kind of thing. And we learn how neurons and glial cells in the brain communicate with each other. And we know that the amino acid glutamate is a neurotransmitter in the brain. And if you allow the glutamate to persist too long, it causes excitotoxicity and the death of neurons. But it's interesting in this glutamate cycle, and now I'm going into a little bit granular in how brain cells communicate with each other. But the glutamate is released, and if it's not put back into a glial cell, it can cause some problems. But when we go after a tumor in the brain, we create a big wound, and then radiation and chemo and this kind of thing. And the two fuels that drive the dysregulated growth, which is glucose and glutamine, are made hugely available in the microenvironment of the patient. So the radiation causes brain swelling and heat, and has to be managed in time with dexamethasone, a steroid hormone, which raises blood sugar to extremely high levels. The breaking apart of the neuronal glial cycles releases massive amounts of glutamine into the microenvironment. So the two fuels that are absolutely essential for the growth of the tumor are made massively abundant in the brain of the patient that's being treated. And you can see why survival is so low is because the treatments themselves are in large part responsible for the rapid demise, the recurrence and rapid demise of the tumor. The colleague, that I have to, sorry about that. That phone never rings, but it rang today.
We did not hear it, so that's good.
Okay, well, any event, the whole thing is that the tumor grows continuously because of the treatments that are being used. And the way to stop that is to know that you need to first restrict glucose and glutamine, and the tumor cell can't use ketone bodies, only the normal cells can. So you can actually shrink it down. If you can get the inflammation and how aggressive this is down, then the surgeon can actually debulk a much greater amount of the tumor. Now, this is also a judgment call on the part of the surgeon. They have to know if there's a watchful waiting period. So if there's a watchful waiting period, they can shrink the tumor down, debulk the tumor, and then go back to transition the whole patient back to metabolic therapy. Some of this is being done today at Cedars-Sinai Medical School in Los Angeles, but they're missing the control group. And the control group is the key group that will change the whole paradigm of how brain cancer is managed. There, Dr. Jethro Hu is doing, we know what the results are from standard of care. They're abysmal, but he's doing standard of care with metabolic therapy. And he's getting some really good results, better overall outcomes. But the key control group is not allowed to be done, which is metabolic therapy without the radiation. And it's the radiation that ultimately leads to the demise of these poor folks. And that's part of the standard of care. So if you can get a trial with patients that can do metabolic therapy without radiation, I think you're going to see even massive, much better improvement. And our guy, Pablo Kelly, who's out almost 10 years now, had a glioblastoma, no radiation, no chemo. He's only had every 3 years, he'll have a debulking surgery to remove what small growth continues to grow. So he's not cured by any stretch of the imagination, but he's certainly
10 years,
managed.
that's a good outcome there.
Yeah.
Because I know that that's a pretty quick death if you get that. I learned about some of these changes through Dr. Charles Majors. I don't know if you've ever encountered his research, but they closed them up and said, you've got 8 weeks to live, nothing we can do, go get your affairs in order. And he went to Dr. James Forsyth. He went to Dr. James Forsyth, who's an oncologist. He's a homeopathic oncologist. And he lived 6 years. And then after that, he just, he ended up passing away of something else. But he was able to reduce that tumor, and he was diligent about what he needed to do in order to survive. But stress is also a killer. People don't realize that we've got to manage the stress too. So what is a ketogenic therapy, or what is ketosis, or what would that look like for an everyday person?
Well, we published, it was made specifically for glioblastoma, the glucose ketone index. I published a major paper on that with my colleagues, students here at Boston College. And we did it based on our attempt to manage brain cancer in various folks, and knowing that it's hard to keep sugar at a steady level and ketones. So we made the ratio of ketones to glucose in the blood. And what we find is that if you can get the ratio down to 2.0 or below, you have a real good chance of reducing the rate at which this tumor can grow. And it can be done. People all say, oh, the ketogenic diet. But you can do it with any diet. If you can get your a carnivore diet, vegan diet, pescatarian diet, Mediterranean diet, people will know what they can and cannot eat based on the ratio number. So it's not like everybody says, can you eat this? I don't know. If that's up to you. You eat what you need to eat. And when you'll find out that you can get down it to 2.0 or below and stay there, then you know what you need to do. So, yeah, so this is the whole thing. And so and people say, well, it's hard to do ketogenic. Well, don't do a keto, do a Mediterranean diet. Do whatever you think you needed to do. And then people say, oh, I can't. And the other thing you got to be careful about with cancer, a lot of cancer treatments, is the treatments themselves make blood sugar go high. So that's counterproductive to what you're trying to do, just like you said about the candy and the cookies and all that stuff. But radiation therapy brings your blood sugar right up. Your body is like under stress. Whenever stress happens, corticosteroids are released inside and they elevate blood sugar. So you don't want that. You want to keep the blood sugar as low as possible. Tumor cell can't live without that. So you need to know all these things. You need to know the basic biology of what you're dealing with. And then a lot of things will start taking care of themselves. I'm not saying there's a cure for cancer and all this stuff that we're doing. All I'm saying is there's a strategy to allow you to live longer with a higher quality of life than currently present now.
That's right. That's right. Okay, so I just want to hone in as we get closer to the end of the class today, and I've loved this conversation with you. To have a blood sugar level of 2.0 or less.
That's a ratio, glucose ketone ratio.
Oh, the ratio. I'm glad I checked that out.
Yeah. It's a ratio, and you can buy it with a Keto Mojo meter.
Okay.
They sell them in Amazon. These meters are available. They're glucose ketone meters. At some point, they're going to have a free Libra thing on your arm you can wear, where you'll measure blood glucose and ketone. The glucose is available, not the glucose ketone free Libra yet, but I think that's going to happen in the future.
Okay, so it's the ratio. So is there because I've heard that if you eat keto, that it will, if you're eating keto and you don't have cancer or a brain tumor or anything like that, it could cause harm in the body. Is that true or not?
No, it makes you healthy.
Okay.
How could you harm yourself by making yourself healthy? Doesn't make any sense.
So is there?
We evolved to be in ketosis all the time. Our Paleolithic ancestors were always in ketosis. We evolved in a ketotic state because we didn't have high carbohydrates in the food chain anywhere.
So it's low carbs, high protein. And
it could be plants, it could be whatever keeps the blood sugar. We're omnivores. We evolved to eat anything that walked, crawled, or fly on the planet, and different cultures have different food. The thing of it is that we did not evolve as vegans. We evolved as people that would eat anything to stay alive. So, but I'm not saying vegans can't get into a low GKI. It might be a little bit harder than some of the other diet options, but everybody can create their own diet. And then water, and they say, oh, it doesn't work, then don't eat anything. Just drink water, and you'll definitely get into GKI that way. And then you'll know what you can add back to give you what you need. It's, again, each person is their own experiment. So what works for one guy may not work for another person. So they all have to do whatever they need to do to get a GKI of 2.0 below. Bulletproof coffee, this kind of stuff. Whatever you want to eat that has low carbohydrates in it could bring you down to the GK of 2 point. Now, that's to keep healthy. It does a job on diabetes. You have diabetes, you get into GKI, you can diabetes with low GKI, high blood pressure, hypertension, obesity, all these kinds of things will all be managed by a glucose ketone index value that you look at. So, and if you have cancer, that's also gets hammered by these dietary shifts. But the cancer, we also use some drugs to target the glutamine, because it's hard to do that with diet and exercise alone. It's hard to completely knock out glutamine. And that's why we pulse it rather than press it like we can for glucose. All this is explained in great detail in the papers that I publish, which are available through open access on Google. So you don't have to have a subscription to a particular journal. You can get this stuff right off the web.
Very good. Is it in PubMed as well?
Yes.
PubMed.gov? Okay,
yes.
Very good.
It's in PubMed.
Just enter your name and it'll come up.
Yeah, even on Google, just say publications, and you'll see them come right up. And you can look at the press pulse theory. You can look at the GKI information. And a lot of these things that we've published on open access so that the general public has access to it. And again, some level of scientific literacy is necessary to wade through this information. But I noticed that when someone's life is on the line and they want to stay alive and they enjoy life, you'd be surprised how smart they become in a very, very short period of time.
Well, that's great advice. It's great advice today to hear that there are other ways that we can perceive or look at cancer. Again, when you change the way you look at things, the things you look at change. And again, as it says in Hosea 4:6, my people perish for lack of knowledge. Make sure that your doctor does not qualify as that you want your doctor to be knowledgeable, but even so, you need to be more knowledgeable. So thank you so much for sharing this information, Professor Seyfried, because it is life-changing. And so I'm so grateful for it. Once again, his email is thomas.seyfried@bc.edu. That's thomas.seyfried@bc.edu. And I have his information. If you click on his name, it'll take you to his email. I'll give you that email when you click on his name. So thank you so much today for being a part of the change and making a difference in our lives. So thank you, Dr. Seyfried.
Yeah, thank you, Lillian.